down. I would have never done that. She was in intensive care, but he talked the parents into checking her out of the hospital against doctor's orders to come down here and have treatment. Well, I took this much lower level frequency generator that I have here and treated her for, she had some purple lesions that you get with lupus, and we treated those and just treated a couple of things that I'd learned from the seminar, and her pain went away. First time she'd had her pain go away since she could remember. She'd been on OxyContin for 2.5 years, and it kind of dulled the pain, but it didn't take it away. So she said, I'm going to get off all my pain medications and drugs. And I said, wait just a minute. You don't want to get off OxyContin just at a whim. You have to go back to your doctor and kind of gradually get weaned off your OxyContin. Anybody here taken OxyContin before on a more extended basis? Nobody here? It's not a good thing to get off of. I mean, the next day, I told her not to do it, but she was a little impetuous and she was excited about how well she was feeling. She just stopped taking it. So that was a Friday. So guess what I get on Saturday morning? I get this call that this young lady is, in tremors and throwing up and sweating and, just miserable shape from detoxing off this OxyContin. So I was a little ticked, but I came down with my laser and I treated her for something I'd never done before, but it had it in a little book, and it was called addiction. Okay, for addictions. We just had her hold her OxyContin in her hand, and we did about, 4 or 5 different points on the body. They're kind of like acupuncture points. And all of a sudden she just stopped shaking and stopped sweating and felt good. Says, oh, great, it's gone. And in my mind I'm thinking, okay, that's fine, but I'm probably going to be here about every hour for the next day, trying to work her through this. Last time I ever had to treat her for OxyContin addiction. So it worked for, the addiction to dependency on a drug. I don't want to call it addiction. Addiction is more involved. It's like a drug addict that has emotional issues involved with it. She wanted to get off of it. She just couldn't physically do it without the help of the laser. That kind of opened my eyes to a little bit of what the laser is capable of. So when I talked to Dr. I treated over the next couple of months, and she did really well. Occasionally the lesions would come back, we'd treat her, and she'd feel good again. And I was telling Dr. Graham about that. He says, well, I'm coming out with a new laser that will actually treat autoimmune diseases. Not treat them, but kind of semi-eliminate them. And I kind of didn't really believe that. But most of what he had said so far was pretty spot on. So he says, if you'll buy my upgraded laser, that's this one right here, it's about $7,500. I will waive the fees for you to have up to 2 other of these new lasers. There's a Mark IV. Half a billion cycles per second compared to 10 million cycles per second. So it was a quantum leap in technology as far as what was being used. And he had gone through and found all of these different frequencies that were actually affecting. I mean, that's a monumental task in and of itself, to find that many frequencies from 0 to $500 million. There was like 200 different cards. And he had put this all together, and for just the cost of buying the laser, he gave me 2 more on a lease basis that I would give a percentage of what I earned to him as payment. And I said, well, how can I, he trusted it worked because he was going to do it on a percentage basis. So I says, how can I lose? The most it's going to be, I think there was a minimum of $150 a month to lease it if I didn't use it at all. Because, well, it's pretty hard not to, if it works at all, it's going to be worth that. So I got this laser, and 5 visits later, this patient, after I treated her for lupus, she went back to her rheumatologist, and she has a lot of different problems from some other things that she had, but she's never been tested positive for lupus since that day. That's about 5 years ago. So they eventually told her that she was originally misdiagnosed, that it really wasn't lupus because lupus doesn't do that. So I was pretty psyched about that we could treat autoimmune diseases. But I have to tell you that it's not something that you can get on the internet and say, we cure lupus. Okay? I'd get shut down in a minute. The system is not set up that way. This is experimental. Everything that we do here, except for musculoskeletal things, pain relief, those types of things are considered post-surgical, and burns are all considered normal things that laser does, and you can do them, and you can advertise that it does that, and you can, systematically take care of that without anybody bothering you. When you start telling people that they can get rid of their diabetes, or they could cure lupus, and I don't really use the word cure, but we can treat these things in a really effective manner, then you start getting in trouble. Okay, you can tell people that this is an experimental way of treating this, and you've had good success in your practice, but when you start putting things in print, that you can't explain things quite as carefully, and pretty soon you're going to have somebody, have some problem with that. So that's why this isn't really big. I can't go out and start just, have a big campaign and advertise that we treat all the things that we do. We treat a lot of things. I would say the next really big situation that came is I had a patient who had a son that was in hospice with dying of liver disease. He'd had viral hepatitis for about 20 years, and he was finally succumbing to the effects of that hepatitis. He was in hospice, and they were giving him all kinds of drugs to just kind of kill the pain until he died. Some of which were actually kind of hard on the liver. And I said, you ought to see if a laser helps, And I remember standing in the office when he came in the first day. He's about 6'4", about 240 pounds, and he had this big staff. And he comes in, and he was like dark. I mean, he looked really dark, and there wasn't any light coming from his. There was no. You think you don't see somebody's aura until you see somebody that doesn't have an aura, and then you realize, yeah, you can see an aura. So he comes in without an aura, just this dark person, and was just. I mean, about that. It took about 10, 15 minutes just to get him back to the room. And I thought, I think maybe I ought to stay away from hospice patients. I think I bit off more than I could chew. His legs from his knees down were just black. He was just dying because of this toxic buildup of the liver not functioning. And so we took him back there and plopped him in the chair, and it was just on lots of morphine and oxycodone and Percocets. And so one of the first things we did is we treated him for drug dependency, because he'd been on pretty heavy drugs for a long time. So we did that, and then we treated him for liver disease, and we did it over a period of about 10 or 12 days. And I remember I got to know his voice, etc. And I remember I was in my adjusting room, and all of a sudden I heard this kind of excited kind of banter at the front desk, talking, and I remember him saying, do you guys have any water anywhere? And I went over and I looked out the door, and he was standing up, full stature, without his staff. He had an aura again, and he was telling jokes and being excited, and went over, got a drink of water, came back and chugged it down, and like a normal person. And I was like, whoa. 5 visits ago he was in hospice dying, and now he's vibrant, off of medication, except he had rheumatoid arthritis, so he stayed on about 30 milligrams of Percocet for his arthritic pain. We hadn't really treated that. And he's in great shape today. He's, back to living and life. I shouldn't say he's in great shape. He has 20 years of difficult living, but he's relatively healthy, and he goes about life fairly normally now. And it changed his life. And that's what we've had a number of situations happening. And every time that it throws me, just like really is interesting. That is kind of what I come to expect. I kind of come to expect these near miracle type situations, and that isn't always the way it happens. Okay? sometimes, healing is more subtle and it's just gradual. But what I've come to know is that if you can ask the body whether it needs something, and it says yes, go ahead and do it. It's worth it. It's going to have value to the body. It's going to heal it in the order that the body thinks is important to heal things. The body is so much more intelligent than anything we have. Any kind of learning that we can possibly have. We don't know all of the intricacies of the physiology of how the body works. And when doctors try to do things, they're brilliant. These MDs are brilliant people. And they've studied how to make the body do certain things, and they can make it do that. But what they don't really know is whether the body really wants to do it in that order. And sometimes they have lots of side effects because of that. With the type of stuff that we do, we try to listen to the body and tell it what it, let it do what it needs to do. Okay, so we try, as a profession, we try to first do no harm. That was the original idea with, the Hippocratic Oath, is first do no harm. I think that's changed quite a bit in medicine. I mean, that's, they try to do that, but they have a difficult time. A couple of things that you need to understand about laser when we talk about it, some of the definitions about light. First of all, not all light is created equal. More is not always better with how much radiation, how much light. I know radiation has a bad connotation because we usually think of it in terms of ionizing radiation.